Welcome to Bite Size Dental Marketing. Today I have Ariel Juday. Ariel, it was wonderful to meet you at the conference the other day. I certainly saw your name a few times with Gina and Dina and the other ACT folks, but it was wonderful to be in the same room and see you at the conference. We talked a little bit there, and I know that you're a lead practice coach there at ACT. I know that you had your master's in healthcare administration, and you've been in dental for a while. I would love to hear, in your own words, your origin story, if you will.
Sure. Yeah, I think just as any of us coaches, right, we started out in dental. I was fortunate to get a chance to work with an office that, had no experience, and they took a chance on me. So that's where I was able to start as a receptionist. And from there, I really just loved the administrative side of dental, as I realized early on that I loved dental, and I really wanted to be in dental, but I did not want to work in people's mouths. So fortunately, the admin side came very naturally to me. So I worked there. I did just about every administrative role that you could think of. And that organization just continued growing basically into a small DSO. So lots of great experience from there. And I worked my way up to the director of the administrative team. So I was responsible for all 5 locations of all of our admin team members, anywhere from hiring to training and support, the unfortunate firing when it was needed, right?
Mm.
But it was just a really cool experience. And I really always latched on to the training and the development of team members, right? I always believed that I could be the best, but that didn't do me any good, right? It was about growing other team members to think differently and to expand their skill sets. And once they're outside thinking the box, right, then they're able to teach you different things. So that was really cool. Unfortunately, ended during COVID, as lots of people's lives changed, right? You had to make a choice. So I did then go into a little bit of the corporate dentistry, where I was able to learn even more of the administrative systems. That is one benefit for sure of the big, large DSOs, right? They have really good administrative systems. So I was able to learn that. I just got to the point that I was honestly tired of being in an office every day from 9 to 5. And so I wanted to do something differently. And I had been following Kirk and ACT for several years, right? That was where I was getting all of my content and my training and, hey, new ideas. And so I just reached out, and I will say, to become a coach, you have to submit a video. And I did not submit it the first time. I just said, nope, I'm not going to do this. Then the ad disappeared, right? And I'm like, okay, well, I lost my chance. It came back, and so I saw it as a sign. I'm like, all right, Ariel, you can submit a video. It's okay. Everyone has survived making a video. So I did, and fortunately I became, a practice coach with ACT, and just really been enjoying it ever since. And, you and I talked about just the core values fit, and just really caring about the community and our clients and our team. It's just so much of a fresh air, right, of being in the other side of it. So I can bring that experience to those team members because I was in their seats and I know how they were feeling and I know what they went through. So yeah, now I'm here and I'm really loving it.
What was your first day on the job as the receptionist at your very first dental office? Did you feel qualified? Did you did you know what you were getting yourself into?
I had no idea, right? And it's a little bit of that, like, well, of course I can do it. Fake it till you make it, right? And then you start having that imposter syndrome of what in the world? The receptionist part, right? I'm like, I can greet, patients. I can check them in. And that was all working, right? I can help stock and I can help keep the reception clean. But then people start talking, and saying dental codes and dental terms. And so you're like, okay, now everyone's speaking a different language. And I'm over here just speaking English and I don't even know what they're saying. So reality hit very quickly that I'm like, okay, this is going to be harder than I thought. But a new challenge. But yes, I will equate it to everyone was speaking a different language around me.
So many people start in an office that doesn't really grow, and there's some skill development, but there's such a richer development when you get to grow with an organization and the demands that they place upon you and everything increases, and it gives you so much developmental growth. But how do you align your journey through the administration side into your coaching today?
So really, well, with the most important part is right is getting to know our doctor and to see, okay, what is their vision, right? Because as a coach, it's not my responsibility to share my experience, right? It's my responsibility to help them say, okay, this is what I'm wanting, and I can use my experience to help grow them in that direction. And that's the one thing I think the hardest part about coaching is, right, is sometimes you want to be like, oh, just do this. But we really pride ourselves in saying, okay, what's your vision? What do you want? And then the nice part about using my experience is that not that I've been there, right? And we've done everything. Everything is a little bit different, and every team member is a little different. But it's like, hey, I felt that before. I understand what it's like to go through change. Because a lot of the team members, they're not too excited when they hear that a coach is coming in.
Almost never.
Yeah, I think I've had one team member, right, that was like super excited about it. And the rest of the team thought they were crazy.
Yeah, no one hired a coach because they were winning and everything was going perfect. Yeah.
Right.
Yeah.
And so that's what they're worried about, right? But we also tell them too is just because you have a coach doesn't mean that your business is failing, right? Because I always say the major league players, right? They're the best of the best, and they have coaches.
They
right?
still go to batting practice. They still do all the things.
Exactly. So if they're doing it, then why shouldn't we, right? And even as coaches, we have a coach that help us, because I think we all just get stuck in our ways, right? And even though no matter how much you want to grow and how much you want to learn, you need someone to be able to push you just to think a little differently.
It's true. We were talking about bad fits or perhaps not ideal fits when it comes to our engagements with clients. And one of ours is, I just want my team to do better. I just want my team to get it. There are certain code words that they'll use that just are like flares when they go up, because it shows I'm good. I don't need a coach, but my team does. And that's a very chilling thing to hear when we get into talking about marketing. And because for us, as you know, when we engage clients and we start driving, when the phones start ringing and you move from heavy PPO and a lot of referrals, which are very easy to close on the phone, right? Do you take my insurance? Yes. And my wife told me to call. Both of those are pretty easy too. I'm now looking at other offices and I want to hear what you have to say. That's a big cultural shift that takes place, and not having the systems around that transition make marketing very hard. And oftentimes they're bad candidates to market because they just don't want to evolve. Like I know how to answer the phone. Well,
sure.
I bet you do.
You do, right? And that's where we see a lot of, and I'm really big about saying, well, let's see the data, right? Because we have to take the emotion out of it, which is hard. We're all human. We have emotions, and emotions drive us. But when I'm making a decision, I don't want to make it based off of emotion, right? Yes, I could say, yeah, I know how to answer the phone. Okay, well, what is my conversion rate, right? And we're doing a lot of work with teams of getting out of that transactional mindset and start building the relationship on the phone, because everyone knows how to get your name, your number, right? Your social security. Do you take my insurance? And it's like, yeah, we all know that. But you're right, is how do I tell the patient on the other side that I've never met, who is sometimes fearful, how do I relate to them and let them know that I could be a good fit? And a lot of our teams are transitioning into that. We're relational, versus transactional. Of, if it takes a little bit longer, that's okay, right? But we're building value from the start, because especially if you're not on their insurance plan, they don't have a financial incentive to see you. So they're choosing to see you because of either the people, right, or the value. It's never the technology, right? I mean, yeah, you can have the best technology, but everyone has the best technology.
Your new cone beam does not ease my anxiety at all.
No.
No.
And as a patient, right, I don't even know what that is.
How do you bring them along? You were hired by a dentist who clearly wants to evolve, his or her practice. Some of the team is going to be receptive. Some of the team is not. Ariel, how do you bring them along the journey to accept coaching and accept that influence?
Starts with the doctor, right? Starts with the leadership team if they have more than one, of really communicating with the team of their vision and why are they bringing on coaching so that they can hear it from their leadership team. Because I could tell them why coach should come in, right? But then it's a sales pitch and no one wants a sales pitch. So really going back to that vision and where are we wanting, and then really just meeting them where they're at, right? We implement a few systems right away, right? A meeting cadence and things and a scorecard. And really it's, okay, let's just start this, right? Like we can all agree that team meetings are important. Well, sometimes they don't until they start doing it, right? But we just ask them like, just trust us, we'll do this. And then by them seeing that, and as I go back to the data, right? I just want them to start recording the data. We don't talk about it. We don't ask questions, right? With the doctor in our coaching calls, we will, right, on the back end. And they always say, like, you're not communicating with my team. And I'm like, hold on. We've been looking at this, right? We're bringing your team along the stages of change. They have to see the understanding and the acceptance before they have any sort of buy-in. So usually the first quarter is all about getting them on communication rhythms, because I think any team will tell you communication's the hardest.
It is.
Right. And so getting them on that, then they start seeing their data. And then we'll start seeing about towards the end of the first quarter, they'll start asking questions. Well, what does this number mean? What is this number? And then we say, okay, let's dive into it. And then once we have their curiosity, right now we can say, okay, let's co-diagnose on what do you think that this is? And then as a coach, right, then we can say, okay, these are some of the best practices we saw. What do you think is going to work with your team? And really make it a partnership. So it's coming in as, guiding them and helping that co-discovery versus coming in and saying, here's a binder of systems. Here you go. Good luck. So it takes a little bit longer, for sure. But I would say, I think that's the difference between coaching and consulting is, right? Coaching, we're teaching them and we're trying to help build them so that they have that ownership and buy-in, because the doctor can't do it by themselves. They really do need their team.
I would imagine the stickiness of it, or the success rate, is also higher by letting them go on their own journey. Because if I come in and tell you how I'm doing it, you will do it under duress, even polite duress, as long as I'm there. Right. But as soon as I leave, I'm sure it reverts back to what I was happy doing before. And by bringing them on, you're changing the paradigm of which they view the problem.
Right.
And that's wonderful. Yeah. When you brought up communication, in our agency, there are many important meetings. I don't want to say that they're not all important, but my favorite is the daily huddle. And I will say, for us, now obviously we're different organization than the dental office, but the daily huddle to me is a place that we all start our day. It's a place where we sort of get our minds right about what we're going to do that day. Some days it's a very tactical meeting around what's everyone's top 3 things or top 1 thing they're going to do. Sometimes it is, what is your dream vacation and where are you at in the planning stage of it? So it spans the spectrum of it. There's a methodology to it, but it's by and large based on the whims of Eric Hubbard, which, is always dangerous. But in a dental practice, what is your dream huddle?
Well, one that is productive, right, and efficient,
Okay.
and to the point, but also not, like you said, kind of like that free flowing, like, yes, we have structure, but there's a little bit of flexibility, and really of how are we going to make today just a little bit better, right? And now we really truly believe that the huddle is about patient care, right? How can we make today, around our patients, and in the aspect of, okay, where are my team members going to need my assistance? So, right. And that's the point of the huddle, because I think sometimes that in a dental office, especially when you're looking at a column, right, and you're a provider, you're like, this is my column, this is what I'm doing. Sometimes we forget that you have several other team members also focusing on their column. And so I think the huddle is just a great reminder of, okay, here's this where it's going to get a little sticky for me. How can I help you here? Can everyone be all hands on deck? And then by the end of the day, right, they're like, oh, that was a smooth day. But we notice that teams that don't have that huddle and don't have that communication, very stressful days.
I think it wasn't Churchill, but it was MacArthur or someone said, the plan is nothing, but the planning is everything. And that has stuck to my ribs, if you will, for many years, because the best laid plans don't survive the cancellation. I mean, we thought they were going to make it, they didn't come in, whatever. But like having the plan of when you need help and how to help you when you need it, I think is such an underrated event of yes, I know that the schedule is not going to work out the way that maybe it was. But by going through it, it enabled everyone to learn how to give help. And I'm with you. I can't run a company effectively without a good daily huddle. And I can miss on some of the goals and I can miss on some of the quarterly rocks and the different styles of things. But if you can't do the day-to-day things well, I don't know that you have a particularly effective organization at the quarterly or yearly level either.
Not as effective as it could be, for sure.
Yeah. When you're talking to offices, walk me through the dream Ariel engagement. Like, how often do you talk to them? You mentioned recording some KPIs in the early days. Walk me through your dream engagement.
My dream engagement. Well, I think right in the beginning stages, it's definitely we're engaged and communicate a lot more, and which is it's great, right? We're getting everyone on the same page and we're learning. And the ideal engagement though is we meet with them every other week, so we meet with them bi-weekly, right? And we have that scheduled out so they have a good cadence. It gives them time to work on anything that we discussed in between, and I think that cadence works really well. As far as from team members' perspective, I really leave it up to them. I will reach out and let them know that I'm here. But my dream engagement is they reach out when they need it. Because that's right. I'm not a big, hover or micromanager. And I do, say, hey, I celebrate and I reach out on that aspect. But in dream engagement, I guess it would go back to is like, they just know that they have the support, but they don't feel the need for every minor detail to be reaching out, and putting out a fire, right? That means I'm not doing a good enough job of helping teach them to find the resources and find the solutions with the support.
That's very well said, Ariel. Gosh. Now, when you look back in the last, year and a half, is there, and we can edit this, by the way. So, is there an office that just sticks to your mind as the gold? I have seen such a dramatic turnaround, or I have seen such a big improvement, some version of that question.
Yes, I would say it all came from team who the leaders were really bought in. They put in the work, even when the team was pushing back. I would say so they're in year 2 and huge success. They're really buying into their vision and what type of practice they want. And I would say for the first 8 months, the team was pushing back of why this? Why do we need to do this? And they did a very good job of letting them know, like, this is what we want to do. And like working with them of, okay, how can we make sure that this is still beneficial for you? Right. And helping them and see it. So right, because sometimes as a leader, sometimes you have to put your foot down and say, hey, this is what we're doing. And that only works so long, right, until you get the team on board. So for them, the team came around when they saw, okay, the doctors are committed. And not only are they committed, they're putting in the work on the behind the scenes as well. So the team saw the growth in their leadership. And I would say right around starting in year 2, they have had so much success. They've differentiated themselves. They have really bought into who they are and what type of patient that they want to see. And it's just been really exciting to watch.
Now, when in watching the leadership of the doctors, and we've talked about core values a few times, but was it the doctors just became better at articulating what the core values meant? And I don't want to say it's that simple, but was that the first step in it, because I hear, I want to grow, I want to get bigger, I want more new patients, I want more production, but those are things that happen. They're an outcome. How do you help doctors articulate that vision?
Well, like you said, right, with the core values, and this particular team, we went through their core values 3 times. So they drafted them, right? They said, okay, these are the ideal team members. These are the core values that we think, and then we just ask questions of what does that mean? And are you willing to hire and fire around these core values? And they always say yes, and they always say they're important. And then we say, okay, perfect. Like, now this is our draft. We're going to implement them. We're going to explain them to the team. And then they're going to celebrate them. They're going to start calling them out. They're going to start looking for examples within their team. And then from there, we come back, and during our calls, you're right. It's like, this is not happening, or this isn't. And it all goes back to, well, did you communicate that? Do you have the same definition? Because maybe the team member's thinking that means something differently than what you're thinking. Right. And so really getting them clear. So then some of those core values start altering. They're like, oh, we said this, but really we mean this. So then they tweak it, right? And then they tell the team, like, hey, we've been celebrating these. And then the team starts doing the same thing. And so that's where I said the third time, everyone was involved. The team said, hey, I think this is actually our core value. This is, I think, what we're meaning. So now everyone has the same definition of what it means. And outside of core values, even, I think from leadership, right, is just their expectations. It's really hard to be clear, right? And we say it as a lot of clear is kind. And if you're not clear with your expectations, you can't expect your team to know it.
That's so well said. Gosh, I think that's a great place to wrap up. If you don't know your core values and you can't articulate them well, it is difficult to be clear. Ariel, very well said. Gosh, it's such an honor to have you on the podcast. I appreciate it.
Yeah, I appreciate it. I mean, I'm so glad we got to see you in person and starting this partnership. I love it.
I know. I mean, we've been chatting about our, going up there and getting to hang out with the coaches on Thursday night. And, Andre and I came back. I sent a note to Kirk just thanking him. And we came back with a ton of ideas of, how we talk to our clients. And I mean, we're marketing. We're not trying to be coaches. We're not trying to be consultants. And I specifically feel comfortable in the marketing domain, and how we talk to our accounts about their challenges, because no one's hired a marketing company because they want more marketing. I mean, that's just a silly, you want new patients,
sure.
And you want productive new patients, and getting behind those questions is the challenge, because they'll start peppering us about SEO or around how much are we doing on paid media. And it's like, well, hold on, like, how is that relating to new patients? And the learning about how you engage your practices, and it's just very humbling to watch you engage. You're right in front of us there, and I loved watching you interact with the dentist there and helping them with the exercises and the KPI worksheets and things like that. You could really see your care for your craft and the offices you have. So it was really humbling to watch you and the team work up at ACT.
Well, thank you. We appreciate it. I mean, like I said, it really is about community and helping them achieve that vision. And that's why we love, right, and working with you, is because I've worked with some of your teams with some of my clients, and right, we're on the same page of, hey, yes, I agree. I understand that that's where you want to go. Can you give us 3 more months, right, to really define this role? Because right, if you implement something too soon, you might as well not implement it at all.
That's right.
So we really appreciate it, and just, right, like having that support too, because of the coaching, right, and right, talking about new patient phone calls of, well, how is their conversion doing? And if our teams don't have a marketing team, they're telling us they're doing great on the phone.
Everyone is. Yep. Sure is. Yeah. Well, Ariel, thank you so much for your time today. And I look forward to seeing you next time in Milwaukee.
Yeah, I appreciate it. Thank you.